In the last hour, resident doctors in England have voted to go ahead with 5 days of strike action in the lead up to Christmas. The British Medical Association said its members voted overwhelmingly to reject the latest offer from the government. They will walk out at 7 a.m. on Wednesday morning. Well, our health correspondent, Rebecca Barry, joins me now. Rebecca, how will this all pan out?
Well, as you say, we've just heard that this 5-day walkout by resident doctors in England will go ahead. 83% of BMA members voted to carry on with the action. The turnout was 65%. The Health Secretary says that this will inflict damage on the NHS at a moment of maximum danger. Hospitals are experiencing enormous pressures at the moment. Flu cases are at a record level for this time of year. They were up 55% in a week. And the government had made a new offer to resident doctors to try and end this dispute. They said that they would introduce emergency legislation to prioritise UK graduates for speciality training posts, and they said that they would increase the number of speciality training posts to tackle the jobs shortage. But it seems that wasn't enough for the BMA, and the Health Secretary is not happy.
The BMA have chosen to strike this week, not only to cause maximum impact and damage to the NHS, but choosing to do so at a time when there is the maximum risk to patients. I think that is irresponsible, and I think it's dangerous. And even now, if the BMA want to reschedule to January, the government will facilitate that.
So this 5-day strike will go ahead from 7 o'clock on Wednesday morning, and this long-running dispute goes on. This will be the 14th time that resident doctors have walked out in recent years, and many will be worried at home and within the NHS. Recent polling suggests that public support for these strikes is dwindling, and NHS leaders have today described this as a bitter pill which will inevitably harm patients and cause damage to the NHS.
Rebecca, thank you very much.